Hi, my name is Sunny Patterson and I'm doing my head to toe assessment, and this is my friend Carrie that is helping me. She's going to be my patient, and so I'm going to come into the room after washing my hands, of course, and introduce myself. Hi, I'm Sunny. I'm going to be your nurse today. I'm going to be doing a head to toe assessment, and I'm going to start by checking her vital signs, which usually are done before they come into the room. I'm going to have blood pressure, pulse, respirations, and temperature. And then I'm going to start by inspecting your skin and looking to see if there's any abnormalities or anything that just kind of pops up that you would just do on a normal assessment. Next, going to look at her hair, make sure it is evenly distributed and it's brown, shiny, and clean. I'm going to inspect her scalp to make sure that there's no flaking or dryness or anything else. Going to look at her nails and make sure that they're not white or clubbing. They look good. So I'm going to inspect her head and neck, make sure it's round, symmetrical, there's no scars. I'm going to palpate your trachea and see that it's midline. It is. I'm going to next do your thyroid. Can you swallow? Okay, and it feels normal. We're going to then start with her head and looking at her eyes. I'm going to start with the olfactory nerve, smelling, and I, would have something like an alcohol pad or something that she could smell, and ask her, what it smells like while having her close her eyes. And 2 is the optic nerve, cranial nerve 2. And then I'm going to test cranial nerves 3, 4, and 6, which are the oculomotor, the trochlear, and the abducens. And so I'm going to have her follow my finger. And while I'm doing this, I'm also looking at her lids to make sure that the lashes are distributed, there's no lesions or anything on them. So I'm looking at her pupils. I'm going to test to see, if they're round, reactive to light. My pen light is missing, so we're going to use this flashlight. I'm going to try my blinder. Good. And then I would have an ophthalmoscope, which I also don't have, so I would dim the light and look at her fundus to make sure that you can see the red brightness of that. Next we're going to have I'm going to inspect her ears to make sure that with the otoscope to make sure that everything is normal and that you can see the tympanic membrane. I'm also feeling to make sure that there is no masses or anything while I'm doing this. I'm also going to feel her mastoids and palpate them. I'm going to test her cranial nerve 8, which is her vesticochlear. And okay. Next, we're going to palpate her lymph nodes. And I'm going to start here and go all the way around. And then we're going to next go to, we would do a breast exam where we would palpate the breast, but we're not going to do that, so would have her stand and raise your arms. And I'm looking to make sure there's no dimpling. Put your hands on your hips, okay, and lean forward. And there's nothing, no dimpling. They're symmetrical. Do you have any tenderness from this? Okay, so next we're going to go to the thorax, and I'm going to watch her breathe. Perfect. Making sure that it's symmetrical, that everything, she's expanding at a good capacity. I'm going to do tactile primitive. I'm going to have her say 99, 99, 99, 99, 99, 99. Okay, and everything is good there, so I'm going to listen to her lungs. Take a deep breath in, all the way out. going to do percussion. I'm going to start here with my 2 fingers on my middle finger. Good. So then we're going to go to the cardiovascular, so if I can have you turn back around. Also, before getting to that point, I'm also going to inspect the nose and the nares, make sure that it is normal. I'm going to look up in your nose. Okay, and the mucosa is pink. I'm going to have you open your mouth. You got your tongue? Alright, and I'm also testing cranial nerve 12 at this point when I see her stick out her tongue. And can you swallow? I'm also looking cranial nerve 10 as she's doing that. So next I'm going to go to her heart and I'm going to listen to all 4. I'm going to listen for the aortic. Tricuspid or pulmonic, tricuspid, and the mitral. I'm also going to listen with the bell of my stethoscope. I'm going to listen for S1 and S2. I'm also getting the cardiac rate. S1 and S2 are both present. There are no murmurs found. I'm going to also listen to her carotid artery. There's no group heard there. I would also have her lay down and would do the venous pressure testing with a ruler. Next, I'm going to inspect her lymph nodes here. And there is a chain going all the way down in her breast. There's 13. You haven't noticed any tenderness. Okay, next I'm going to inspect her abdomen. So I'm going to kind of have her lay down. I'm going to listen for breath sounds, or for bowel sounds in all 4 quadrants. In all 4 quadrants, I'm also going to be feeling for tenderness. I'm going to see if I can palpate the liver. Okay, and I hear bowel sounds in all 4 quadrants. So I'm next going to test, you can go ahead and set up. I would also be looking for the level of consciousness, which of course she's alert and awake. Can you tell me where you're at? Can you tell me what year it is?
2011.
Perfect. So she's oriented to time, person, place, and thing. We would next do her gait. I'm going to watch her walking. She has a normal gait. I'm going to have you stand right there. I'm going to have you close your eyes. You stand, you can open them. You have protect them when they're doing that, so if they get dizzy, you want to be able to catch them. You can sit down. I'm going to test her range of motion in all of her joints. I'm going to have you raise your arms. And can you do circle? Okay, now I want you to do your arms in and out, and your hands in and up. Looks good. I'm going to have her do the same with her legs. In, out. Perfect. Can you raise your hip, or your left side to your hip? Okay, and do your ankle. Perfect. I would inspect all her joints to make sure that I don't feel any inflammation or edema. I'm also going to inspect all of, or feel for all of her pulses. So we'll do brachial and radial, and then on a we'll do femoral and the popliteal, and the dorsal pedi. I'm also going to have you stand up. I'm going to look at your spine and I'm going to have you lean over so I can tell if there's no scoliosis present. You can get back up. And this is it for my head to toe assessment. And thank you, Carrie, for being my patient.
That was the